And we begin here with coronavirus in Wisconsin. More than a month ago, Governor Tony Evers predicted the state's death toll from the disease would double by the end of the year. And if the current average continues, that would occur. Today, NBC 26's Eric Kress reports on what current trends mean to a local doctor.
The warning of a potential deadly surge of COVID-19 in Wisconsin was vocally expressed by the governor just over 40 days ago on November 11th.
The Institute for Health Metrics and Evaluation estimates 5,000 Wisconsinites could be lost to COVID-19 by January 1st if no further actions are taken to get this virus under control.
Since the time the governor said that, COVID-19 related deaths have almost doubled in Wisconsin, from 2,457 on November 11th to 4,614 today. On Tuesday, Wisconsin doctors saw the state's deadliest day of the pandemic when DHS reported 120 COVID-19 related deaths.
The deaths increase that you saw yesterday is really what we call a lagging indicator. Most of the death we see in the hospital doesn't happen with COVID when you roll through the doors. It's people who have been in the ICU for weeks, even a month.
Dr. Ashok Rai, the president of Purveya Health, says we may be on the verge of a third surge of COVID-19 in the coming weeks.
And now it's slightly ramping up a little bit as far as hospital admissions go.
And a main contributing factor, according to Dr. Rai, is less folks are getting tested for the virus now. DHS reports there has been about a 50% drop in testing compared to back in mid-November.
You always want to celebrate when you see people not having COVID, and we're very excited about that. We are concerned, though, that not enough people are coming in for testing.
This week we saw the 7-day average for new cases of the virus drop to the lowest point since October. And while that had many excited, we were starting to see an optimistic trend. Healthcare leaders warn it could have much to do with the lack of testing.
We're hoping anybody with symptoms gets tested right away. Even if you don't have symptoms here in Brown County, you can be tested.
In Brown County, Eric Kress, NBC 26.
Healthcare leaders say Christmas gatherings could contribute to a spike in COVID cases. They encourage people not to rely on a negative test to help decide on whether or not a visit with people outside of one's immediate household is a good idea.